The average woman waits about 13 weeks before visiting a doctor after first experiencing symptoms of a serious disease. Sometimes feelings of discomfort mean nothing, but sometimes these feelings can be your body's way of telling you there's something else going on. If you listen and seek treatment quickly, you can prevent an emergency or an irreversible diagnosis. Today's video is all about these symptoms and how you can identify them. Let's begin. Number 12. Frequent skin breakouts. About 2 weeks before menstruation, your body increases estrogen and progesterone. Because of this change in hormone levels, you may experience an acne breakout on your chin that should go away shortly. However, if you consistently have pimples on your jaw or chin, it might mean that your hormones are unbalanced. Acne breakouts can also be a symptom of other imbalances. The body may be producing too much oil or has come in contact with bacteria. Consistent acne that's unresponsive to treatment can indicate hormonal imbalance. It can also occur when you begin to go through menopause as well. Number 11. Bloating. For some women, bloating is part of their monthly period, but if it's unusual and you've been experiencing it for more than 2 weeks, this may be the first sign something is out of balance. In the case of endometriosis, your stomach can swell and get worse as the day goes on. Endobelly is usually unpredictable, and bloating can stay with you for days or disappear after a couple of hours. Besides that, constant bloating could be a sign of breast or ovarian cancer. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 10. A swollen neck. The front of your neck is full of lymph nodes and your thyroid gland. Swelling there can be a sign of infection, lymphoma, swelling of the thyroid, or masses within the thyroid gland. Lymph node swelling is common with a cold or sore throat, but if it persists, have it checked out. Number 9. Frequent heartburn. Heartburn is an uncomfortable burning sensation in the throat or chest from stomach acid. It can be caused by eating decadent, spicy foods or consuming alcohol. Obese or sedentary people are more inclined to suffer from heartburn, as well as smokers. If you find yourself popping heartburn pills more than a few times a week, there could be some unpleasant side effects. Avoiding the condition can eventually cause inflammation in the esophagus, which can lead to ulcers and serious bleeding. You may also be putting yourself at a greater risk for esophageal cancer if you ignore your frequent heartburn. Number 8. Unexplained weight gain. An unexplained rise in your weight, unrelated to the regular fluctuations before your period, could be a medical condition such as hypothyroidism and Cushing's syndrome that cause fluid retention, known as edema, which may point to kidney disease or cardiac problems. Number 7. Blood clots during menstruation. Every period is different. It can be lighter, darker, heavier, and so on. A blood clot or two every once in a while is absolutely normal. However, if your blood turns dark and the clots are consistent and very large, this could be a sign of uterine fibroids. These non-cancerous growths in your uterus can cause abnormal bleeding and even be a sign of bladder issues. Number 6. Sleeplessness. As you age, the amount of sleep your body requires is known to decrease, and occasional restless nights are common. But if you have been unable to sleep, there could be a problem. Depression, hyperthyroidism, GERD, sinusitis, and arthritis are some of the ailments known to cause sleeplessness. Number 5. Frequent headaches. Hormonal changes can cause an achy head, but a sudden, acute headache may be a sign of a brain aneurysm. More common in women, up to 5% of people who experience a brain aneurysm don't notice an arterial bulge or ballooning in the skull. Most brain aneurysms don't rupture, create health problems, or cause symptoms. Such aneurysms are often discovered during tests for other conditions. When a rupture is accompanied by a severe headache, as well as confusion, blurred vision, and nausea, your health may be at risk, with potential complications ranging from brain damage to rebleeding. Prompt medical attention in these cases is crucial. Number 4, constantly tired. Women still carry the double burden of home and office, and today's lifestyle means it's hard to differentiate between occasional and constant fatigue. One way is to take note of fatigue levels after getting a good night's rest. If you feel exhausted, even after a good sleep, it may indicate something serious. Constant fatigue could be indicative of depression, liver failure, cardiovascular disease, sleep apnea, cancer, kidney failure, diabetes, anemia, even chronic fatigue syndrome. Number 3, chest pain. Women tend to think of chest pain as heartburn or indigestion. However, chest pain should not be ignored under any circumstances. If chest pain is accompanied by shortness of breath, pain in the left arm and shoulder, and hot flashes, it could be an indicator of cardiac disease. Cardiac blockages in women are detected after menopause often because the hormone estrogen produced by the uterus contains lipoprotein, which is a good form of cholesterol that helps with movement of the heart. When the uterus stops producing estrogen after menopause, women are often at risk of cardiac disease. Number 2, constant pelvic pain. Pelvic pain is different from usual cramps. It can be sharp, one-sided, and may come on suddenly. If it is on the right side, it could point to appendicitis, a right-sided ovarian cyst, a rupture, or kidney stones. If it is on the left side, it may indicate a left ovarian cyst or rupture, diverticulitis, or left-sided kidney stones. If you have severe, lasting pain accompanied by bloating, you can suspect ovarian or pancreatic cancer. Number 1, a persistent cough. A nagging cough can linger from a past cold or flu. However, if you have a persistent cough that didn't come from a prior illness, it's cause for concern. If you're a smoker, you may have a smoker's cough, which can be cured by quitting. If not, your cough could be a symptom of something serious, like lung cancer, a lung infection, or pertussis, also known as whooping cough. If your cough is accompanied by a fever, it could be a lung infection that needs antibiotics. Whooping cough and lung cancer need to be treated immediately. Your body sends all sorts of signals when something isn't quite right, from issues with your heart to cancer. To learn more about these signals, watch 7 Signs Your Body Gives You a Month Before a Heart Attack, or Heart Disease Warning, 15 Early Signs to Watch Out For. Go ahead and watch one or both videos to understand your body's signals better. Have you ever experienced any of these symptoms? Let us know in the comments section below.